So there is insufficient amount of gas to be inhaled by a patient. See, what is our demand? What is the amount of air to be inhaled by a patient? That is minute ventilation. And suppose there is a less amount of gas in the circle, then minute ventilation is called. It creates the gas volume deficiency. Where it happens? Whenever there is leak in the system, that is one thing. And when uptake is more, these two are the causes of gas volume deficiency. So, what should be your lowest flow to optimize low flow anesthesia? How low you can flow? So, your delivery of gases should be equal to or more than leak plus agent, leak plus gas uptake in the body. Suppose if you consider a 50 kg patient, and that's the reason always check the leak before starting low flow anesthesia. Suppose your machine is displaying the leak is 250 ml, then what should be your lowest flow? Leak is 250 ml, and you are conducting a case of a 50 kg patient. That patient's oxygen consumption is roughly 250 ml. So 250 ml leak plus 250 ml oxygen gas uptake. So 500 ml. So you can't go below 500 ml as a low flow anesthesia. Suppose your system leak is 250 ml and you are conducting a case of obesity of 100 kg whose metabolic demand is 500 ml. Then your lowest flow should be 250 ml leak plus 500 ml gas uptake up to 750 ml. This is how you should optimize your low flow anesthesia technique. So, how to diagnose the gas volume deficiency is happening. So, whenever that we'll discuss later. So, is it possible to conduct a low flow anesthesia with the supraglottic airway devices? Many people are having confusion. It should not be used. No, it can be used, but there shouldn't be any leak from the supraglottic airway. And each supraglottic airway is having its airway leak pressure. Suppose you are using IGL, its airway leak pressure is around 26 to 30. So in such case, find out the airway leak pressure and keep the patient on the pressure control and keep the inspirative pressure less than 26 in case of IGL airway leak pressure. So that is how you are minimizing the inspirative pressure, and that is how you are minimizing the leak. In such case, you can continue with the supraglottic airway devices. So this is how you can conduct the low flow anesthesia with the supraglottic airway devices. Now, how to diagnose gas volume deficiency? The gas volume deficiency can be diagnosed in bellows-driven machine by a fall of bellow. Is suggested if your fellow is going down, not touching the top portion, is suggestive of there is a leak or there is a gas volume deficiency. Or if you are using a piston-based circuit, then collapsing bed is indicative of gas volume deficiency. Or if your plate-to pressure is gradually going down, that is suggestive of gas volume deficiency. So, if you're using oxygen nitrous mixture and nitrous uptake initially higher, that already we have discussed. So nitrous uptake is initially higher for first 10 to minutes, and if you are supplying with the low flow, it creates uptake is higher and supply is low, creates the gas volume deficiency. But if you don't use nitrous, you can reduce the flow much earlier compared to gas nitrous mixture into oxygen nitrous mixture compared to oxygen air mixture. You can reduce the flow much earlier to low flow or metabolic flow, but you should need to ensure optimal depth of anesthesia in both the cases.